Public Health and Social Services, Linda Pinko Denorcey. Good morning, Linda.
Hi, Linda.
Good morning.
Thanks for taking some time. We know you're extremely busy. Jeez.
So, Linda, it kind of looks like you guys got some higher numbers yesterday at the community testing. 86 people showed up. What did you do different than Saturday, or was it just that maybe people knew about it longer?
Yeah,
Also,
it's a combination of both. We had a whole schedule that was listing all the different dates that we're going to be doing this outreach, and so people will have a selection of what's convenient most for them. So I think that helped a bit. As you know, we had the outreach earlier, which was Saturday, and we had 52 tested, and of that amount, 47 were negative, and one was a follow-up, 3 were repeats, and 1 was invalid. And then our staff, what we did also differently was we wanted to be closer to the area where they go in and they're cleared, so that will save a lot of time. And of course, as far as advertising for this outreach, the mayors did a great job. We passed out the flyers to all the mayors in every single village, and we did everything electronically as well, and our staff have been out there, continually advertising about the education and the importance of getting tested. So I think that helped a great deal.
Right. I know when you guys had the press conference and you made the announcement on Monday, I think every single person in the media was like, get those graphics ready, put it out, put it on social media.
Yeah.
We're like your ad agency, Linda. We're working hard, and you just got to give us the info a little bit earlier, and we pump something out nice.
No, we work fast. So,
Yeah.
we're trying to get all this thing done, and it's not just up till today. Today we're excited because now we're going to take the entire island. Again, it's going to be at Stumbo. We're just trying to finish up at the north, and that's going to be at 3 to 6 p.m. So I hope you can also help us to advertise that.
Of course.
And then Thursday, which is tomorrow, we're gonna move now to the central region of the island, and that's going to be from 3 to 6 p.m. and it's going to be at the Manilo Senior Center, right adjacent in line with the Manilo Night Market, and where Santa Teresita Church is. That's the area. And that's open to any central residents of Agana Heights, Aspen, Mahina, Barragata, Chalampago, Orda, Agatna, and Manila, Momonto, Tumaiti, Sinahanya, Tumaning, and Tumon. And then finally, Friday, May 1st, we're going to Agate Senior Center. And adjacent to that, we're going to use both areas. DYA has a youth center, and that's going to be from 1 to 4 p.m. This one is going to be open to all residents of the Southern. As you know already, Icat, Inalahan, Marizo, PD, Santa Rita, Talafofo, Umatic, and Jonya. And then on Saturday, we keep our staff very busy. We're going to do outreach, and we're going to actually do all the swapping in the areas where there are congregate high-risk homes. And then we're also reaching out to the homeless population in Agatna. And, through our journey the following week, we're going to continue on, and we're looking at other areas like we're focusing on Hemlani area, that whole region where we're going to go into Harmon, Tumuning, Marizo, and Maiti. And very vulnerable population, as you know, is our elderly. So we're going to be also looking at the Gumat Tranquilidad housing area. And, of course, St. Dominic's. We've been in communication already with St. Dominic's, and everyone is very, very excited. We would like to focus on the Manomcos. As you know, this virus really takes its toll and hit on those that are over 60-some years old. So we want to make sure they're well protected.
Okay. Well, hopefully we can get a calendar out for you and to help spread the word once you finalize all of that. I did want to follow up on something, though. We talked about a week ago regarding the homebound, the people with disabilities that can't make it to the testing sites.
Yes. We will, Sabrina, we have staff that actually go out into the field, so it's not like they just come in and walk in and drive through. If we get any suspicion of anyone connected by household or contacts, or even they call our hotline, right? We can get their name, their contact information, and our staff will go out in the field and we will do the swap. And that's what we're planning to do on this coming Saturday. We're going to start off going into these continuous congregate homes, housing, as I mentioned earlier. But you didn't ask me how the test result was yesterday. It
Yeah.
was 86 tested. That was
Right.
really good.
Yeah, no, that's where we started.
Said
Yeah.
it- we said it-
Positive.
Yeah, Linda, good job. What kind of numbers and how many test kits are you bringing with you today?
Okay, today we already have our nasopharyngeal swab in our virtual transport medium. We have 200, but I have a 200 backup, and not
And
to
you got
worry,
backup?
because if I need more, I have more backup. Yeah.
Bring it, guys. Come on and get tested. We got
Go.
backup.
So we want to get this thing done because, again, the data, we reported all to the governor,
Right.
and she and Dr. Mike Cruz really are monitoring everything. I know they're really wanting to go into recovery, and I know everyone's anxious and excited, but if we don't do what we need to do, we don't want to move too quickly now, because we don't want a second wave, and that's what we're trying to do. We're trying to reach out to these pocket areas of infection so that we're able to see what is out there that we probably have not reached, or they can't come into our facilities, whether it's the hospitals or the community health centers
Right.
or any of the private clinics.
Linda, so just to really just clear it up, people who show up at the community testing today, they don't need to bring any money. It's absolutely
No, it's
1,000% free.
Of course. It is absolutely free. They do not have to pay a penny. Yes.
And then also, we had got a call from a listener a little while ago, and she had told us about a positive case, and I guess it was the individual was self-isolating in the home, and the rest of the family were not tested. And I'm just thinking at that time, was that one of the criteria if you had come into contact with a COVID positive? And and then today, if this was to happen today, would that family be tested under the new criteria?
Yeah. Well, when they are tested and there's a positive, what we want to assess is other people in the home front, right? And also the conditions in the home. For example, if there are other people that live there that may be elderly or they may have comorbid conditions, we're also concerned because the individual that lives there may spread it and of course, be in close contact with these people that are living there, and they might be contaminated, and of course end up having with the virus. If we also, not only that, we also look at if they're in the home front, do they have their own, bathroom, or can they really be isolated, separated from these individuals that live with them? They have their own bedroom, and again, if that conditions are met, then we can have them home isolated, If not, then we will move them out and tell them we can put you at one of our government of Guam isolation facilities, and then they can be there and be closely monitored. We have our nurses there, and they will check them every twice a day, and anytime they call, whatever needs they have at the isolation facility.
I
So
think
was that a yes, Linda? They would be tested today, and
If
should
they
they
were
have been
to go.
tested back then?
That's another part of our movement forward. If they are living and they tested positive, sometimes the person could be asymptomatic, and our plan is later on is if they are closely together and the chances are that they may be exerting symptoms, of course we'll test them right away.
I had a comment here on our Facebook. I went to get tested from Jess at a Stumbo gym yesterday. When do we hear back the results? I saw the latest count, and they said only one tested positive. Is there a number to call to check? I haven't heard back from anyone yet.
Yes. Normally when we do the testing, the results came out really, really, really late at night.
Right.
It was like about, I would say, close to 10:30, because I was waiting for the results. Normally the testing, we at Public Health in the lab don't tell you what the results are. We tell, we go through the providers. Normally in this particular case, they will be notified, and I believe that we'll make certain that their provider notifies them. And in this particular case, because it's a walk-in, I'm going to make certain that this information is filtered throughout the community health centers. They will be notified. There's only one positive, so and if again, because they probably haven't been notified yet, It's a link that we identified in a previous cluster.
Oh,
So
can
if
you
they
give us
feel
more
that
info
they're
on
linked to a
that,
previous
Linda?
cluster.
Which cluster
Yeah,
was it?
that was a link with the Iglesia Ni Cristo Church.
I see.
Yeah, so if they feel they didn't go to the Iglesia Ni Cristo Church, then I think they're one of the 85 negatives.
Okay.
Okay, is that good enough?
Yeah. So, hey, Iglesia de Cristo, let's go get tested. By the way.
I really encourage all of them to come in,
Right.
seriously, because if you don't know and you're just thinking, oh, I might be, I might not be, I'm scared, the only way to alleviate those fears is to be tested, and then we will guide you through so that your fear is minimized, and we'll give you all the education. We will do all we can to get you to recovery. As you know, we are now at 130 that have recovered as of April 28th.
Yeah, Linda, we played that video from the 92-year-old recovery patient. That
really
was
nice.
pretty cool. Good job there.
No, it wasn't that beautiful. More coming out, and they really want to tell their story.
92 years old. Wow.
I know, she looks so young, doesn't she?
Mm-hmm.
Yep, she's drinking her bija juice. Sorry.
So bad.
Hey, I wanted to follow up on a phone call we had yesterday because everybody's talking about, is it free or is it not free, and there was
free.
Even if you have health insurance though, if you have health insurance, you go to the clinic.
Yes.
Okay, so this guy was turned away. He went yesterday.
That's probably because he's asymptomatic.
Okay.
But you know what?
Can we just tell people to just say you lost your like Mayor Savars did, say you lost your sense of taste, sense of smell?
Chris, we're planning. Just tell them to come and just bring them down there, and we're going to test. Okay.
Okay. Yeah. So the guy
so that shouldn't be a barrier.
Okay. All right. So I think his name was Ed.
Ed Quintanilla, comorbidities. Yeah. Got diabetes. Goes to dialysis. Yeah. Linda, I don't know if you got my email already, but we just have to ask you. There was a report that came out about the governor's chief of staff, Tony Babauta, staying in a suite at Pacific Star, and I sent all the FOIA requests this morning, but I know that Pacific Star billed your department for the quarantine there at the hotel. So is there anything you can tell us about the accuracy of that information?
The accuracy of that information, I just wanted to let you know that I believe he just spoke with me the other day. He wasn't feeling too well, so he wanted to make sure that he didn't want to affect any of his family. He does have elderly parents, so he wanted to make sure that he was not in close contact with people that is very dear to him. So I believe that's what happened.
So he's just basically self-isolating at Pacific Star?
Pretty much. That's what he told me.
Did he say that he was feeling symptoms or something, and has he been tested?
Yeah, he wasn't feeling too well. That's what he told me yesterday.
Does he know there's free community testing out here?
I believe that everybody in the community should know because, of course, we're launching this whole testing to everyone. So I'm not going to single out anyone. I just hope that everybody is, reaching out to all these opportunities that we have, that we're trying to move forward in our quest to recovery.
But Linda, if I called you guys and said, hey, I don't really feel good, I got some family members, would I be able to check into the Pacific Star without a test?
Of course, we will monitor you, and we will get your information, and our team will come and we'll contact you, do our assessment.
Okay. And you said you found out yesterday, you spoke with him, that he wasn't feeling well?
Yeah.
Right. How long was he staying though at the
I don't know that information. We didn't get into details with that. I was too busy hurrying up to get other things that were very vital to be done, such as informing about other things that are related to the government. We always get the count.
I know you're busy. You're not. You're too big. You're not a concierge. So what was
last night with testing that had to be done in the evening. So my nurses were on standby waiting, and so that's why I really had to get a lot of work done yesterday.
Right. So Linda, is he staying in a suite?
I have no idea. You know what? I don't go into the details with that, and I'm being very honest with you because I really didn't go into the details. I always give you the factual information.
I know you do.
Yeah, so
Okay.
please understand that
No,
I'm
we
just
understand.
giving you the information that I know.
No,
okay?
Linda. I mean, we asked you about the Gita director, and you told us point blank. So yeah, I mean, if
Yeah.
the people I see, the people I want to ask, and I know I'm going to get a straight answer, at least what they know, I feel like you're one of them.
Oh, thank you, sir.
Yeah.
I appreciate that.
Okay.
And I know I'm going to be in another interview with Patty Arroyos at certain time. So
So at
I'm
least you
so-
got to practice your answer a little bit.
Yeah, you and Sabrina always give me the tough questions too. You know? But I really appreciate it, and I want to just thank everyone in the media. You guys have been doing a superb job as far as giving the information out to the community, and I can't thank you enough for all that you have done to help our island as well. So it's very important that we give out factual information, and we continue to keep them posted and let them know that these outreaches are there to help them. And, we don't want you to feel like you're all alone. We want you to know that our staff will also go out and find you in your home. That's what we're going to do in the next series, is go into the homes and swap them right on the spot.
Wow.
Is that like next week?
No, this Saturday we're going to begin.
Oh, the congregate homes. Okay,
Right,
yeah.
right.
Yeah,
Okay.
the congregate homes,
Mhm.
the apartment units.
Hey, Linda, let me ask you. So after we do this round of community testing this week, are we then going to do another round in a couple weeks, or how's that schedule going to go?
Yeah, okay, that's a very good question, because right now, we're going to see how the results are. Our goal is to move forward, as I told you, going to these congregate homes and the senior citizen, St. Dominic's, and also the Guma Tranquilidad, and these
Hemlani.
homeless, and the homeless individuals, right? What our next step, and I'll tell you right now, is we want to go to the frontline workers. We want to go to those that may have been exposed via they're transporting individuals, like the fire department and also the police, because they pull people over, they're in contact with people. And then we also going to focus on the healthcare workers, all the people that are working in like the hospital, and of course public health, the nurses, and the surveillance team that go out there, and actually all our staff that do the swabs. They're in isolation quarantine facilities. We're gonna go to all of them, and of course the behavioral health that deal with patients, that are nurses there too. We're gonna start with that, and I think the governor should have a feedback from the department as far as our confidence. We're not going to let our guards down. We're going to continue. If we move forward, we're still going to beef up our isolation and quarantine enhancement. In other words, we're going to enhance it, because if we continue efforts, we want to make sure that anyone that arrives on Guam continue to be isolated or quarantine, and then become isolated if they experience symptoms or they're positive for COVID. So these are things that we want to make certain that are still in place, and hopefully down the road we want to keep that permanent within our department, to have a unit for that specifically. And as we journey towards elimination and recovery, these are the things that we're planning to do at this time. Does that answer your question?
Yes,
Yeah.
it does, Linda. Very
but
thoroughly.
I have one question. Hi.
Yes, Sabrina.
Okay, so the governor, she said, I think it was last week, that as they work on the economic recovery plan, it is a plan that has to be approved by the Department of Public Health. Correct?
Yes.
So what
That
is
is, well, not only us, but she also has her advisory council, and she also are physicians, and she also has her recovery committee, that or task force that is built in. So I think it's all
but she's
everyone.
also said that the Department of Public Health is in charge of our COVID
Exactly.
response. You guys are like the end all be all, I guess, when it comes to COVID recovery. And having said that, what are the what has to be checked off for you to say this is good to go? This recovery
when
plan.
we see that all these pocket areas of infection, there's very few, as you can see, and that we're seeing lots of negative results, and people are in good condition, that they don't exhibit any symptoms. And again, we'll get that all verified and clarified with our CDC advisors that are here on Guam, especially our epidemiologist, Dr. Thane Hancock. We're all going to be coming together as a team. When we see lots of negatives and people not being sick, I think that would be a great sign, especially in these pocket areas of infection that we probably were not aware of these individuals. That's what we're aiming for, because they couldn't come into the hospital or at our community health centers or at the private clinics. So that would be our sign. Data will drive this, and let us know, and that's what we're aiming for, and that's why we're working as fast as we can.
Right.
All right.
And I know that you guys also have the Division of Environmental Health. You have your public health inspectors.
Yes.
And if they decide to reopen
Yes.
restaurants, I mean, I'm sure that you probably have requirements that have to be in place
Yes.
before
Right.
you would make
One
a
of the
decision.
requirements. Yes, one of the requirements we're thinking is, we're going to scale down on the percentage of people that are dining in, and then of course practicing social distancing in the restaurant. So that's going to be always in place, and then as we journey through, we're gonna do it slowly. We're not going to be very rapid, and again, the occupancy of these restaurants will be at a lesser percentage.
Linda, let me just ask you, because this is something I was thinking about. When you open the restaurant, we do dine in. I take someone out to dinner, the kids out to dinner or whatever. Who's wearing the masks at the dinner table? Is it going to be the servers? Is it going to be the customers? Do we wear the mask and then move it to eat? Or how's that going to work?
Yeah. Those details, as far as everybody should be wearing masks up to this day, whether you're dining in or not.
Right.
In my opinion, even
Yeah.
the cook.
I
So
see,
that's
I
what
see.
I want to keep in place. I don't want to be too lax at this
Yeah.
point. So
Yeah. No, good.
let's take it one step at a time, and then as we journey through, we'll have some more guidelines that we'll put out to the community in our memos, and that will be very clarified for
Thank you.
everyone in the
Yeah,
community.
send it over so we can
Send
get
it
the
over.
PSAs
we
out.
Gotta, we got to work on our graphics, Linda. Send it.
Okay.
Okay.
Thank you so much.
Thank you, Linda,
Okay,
so
good
much.
luck
Appreciate
today.
it.
Okay.
And
Thank
wash your
you.
hands. Wash your hands.
Thank you too. Bye-bye.
Okay,
Okay,
bye,
bye.
Linda. Oh, there you go, Linda Pinko, Denorcey, 735. She seems reinvigorated, right?
Yeah.
I mean, they want to get out there, get this testing done, and obviously it's a big part of whether or not we're going to reopen non-essential businesses.
Mhm. Yeah. I
Wow.
mean,
She
she's
actually.
got so much on her plate.
Wow,
Because
yeah.
public health, when you think about it.
Why would you
they-
name Iglesia de Cristo a COVID hero, but not Linda Pinko Denorcey?
And all her staff. I mean, her staff were incredible.